Every year we see headlines about wildfires. They dominate the news cycle, filling our screens and newspapers with images of destruction and devastation. Orange skies, evacuations, chaos. These scenes become all too familiar during wildfire season, painting a picture of communities under siege. But as a doctor, I want you to look past the flames, beyond the immediate spectacle of the fire itself, and focus on the real danger. What wildfires do to your body, the often unseen and underestimated health impacts that extend far beyond the burn zone. It's not just about losing your home. It's about the potential for severe and lasting damage to your health. It's about life-threatening injuries that can happen in seconds, injuries that require immediate medical attention and can have long-term consequences. The heat, the smoke, the unpredictability, these aren't just abstract dangers. These create medical emergencies you need to be ready for, situations where quick thinking and preparedness can make all the difference. Wildfires move fast, faster than you can run, often outpacing even the most determined efforts to escape. The air itself becomes superheated and toxic, a dangerous cocktail of pollutants and extreme temperatures. Imagine trying to breathe in an oven filled with poison. That's the reality of smoke inhalation during a wildfire. Surviving isn't just about avoiding fire, it's about understanding and mitigating the hidden dangers. It's about surviving the environment it creates, an environment that can be just as deadly as the flames themselves. The two biggest threats, the ones we'll focus on today, are burn trauma, the immediate and devastating impact of extreme heat on the skin and underlying tissues, and smoke inhalation, the insidious damage caused by breathing in toxic particles and gases. Most people underestimate how quickly things can go wrong in a wildfire situation. The speed at which a seemingly manageable situation can escalate is truly alarming. When you're panicked, your brain can freeze, making it difficult to think clearly and react effectively. But if you know what to do, if you have a plan and the knowledge to execute it, you can act fast and save lives, potentially your own or someone else's. We'll break down what these injuries look like, how to identify them quickly and accurately, what they do to your body, the physiological effects of burns and smoke inhalation, and what you can do about them in those critical first moments. This isn't about fear, it's about being ready, about empowering yourself with the knowledge and tools you need to face a wildfire emergency. With fire seasons getting longer and more intense, fueled by climate change and increasingly dry conditions, this knowledge is more important than ever. Think of this as your emergency medical briefing, your crash course in wildfire survival from a medical perspective. We'll cover first aid, essential techniques for providing immediate care in the field. Red flags, the warning signs that indicate a situation is rapidly deteriorating and requires immediate action. And when to get to a hospital, how to assess the severity of an injury, and determine when professional medical care is absolutely necessary. Let's get you prepared, equipped with the knowledge and skills you need to protect yourself and your loved ones. Let's get started and turn knowledge into action. Let's talk burns. Wildfires cause burns from direct flames, superheated air, or hot surfaces like metal or asphalt. Burns are classified by depth: first degree, like sunburn, second degree, painful blisters, and third degree, deep, often painless because nerves are destroyed. In a wildfire, you're at risk for all three. Even small burns can become serious if they cover a large area. Second and third degree burns are medical emergencies, especially on the face, hands, or joints. Infection, dehydration, and shock are real risks. Knowing the type of burn helps you respond correctly. Recognizing severity is the first step to saving a life. Now let's talk about a danger you can't always see, a threat that can be lurking in the air around you. It's smoke inhalation. This is when you breathe in harmful smoke particles, and it can have serious consequences for your health. Wildfire smoke is a toxic mix, a complex cocktail of hazardous substances. It contains carbon monoxide, an odorless, invisible gas that's incredibly dangerous. There's also cyanide, a highly poisonous chemical compound. And of course, fine particles from burning materials, tiny bits of ash and debris that can penetrate deep into your lungs. Breathing it in inflames your airways, causing irritation and swelling. This leads to coughing, wheezing, and difficulty breathing. In severe cases, it can quickly block oxygen to your organs, leading to serious health problems. Carbon monoxide is especially deadly because you can't see it or smell it. It hijacks your blood's oxygen delivery, preventing your red blood cells from carrying oxygen to your tissues and organs. Early signs of smoke inhalation can be subtle, but it's important to be aware of them. These include coughing, headache, hoarse voice, confusion, and soot around the mouth or nose. It's crucial to remember that symptoms can worsen hours after exposure, even if you initially feel fine. This can lead to life-threatening lung injury and long-term health complications. Anyone exposed to heavy smoke should seek medical attention, especially if the exposure occurred in enclosed spaces where smoke can accumulate. It's vital to get a medical evaluation promptly. This is important even if they seem okay, as some effects may not be immediately apparent. Don't underestimate the risk of smoke inhalation. Smoke can kill silently and quickly, so it's essential to take it seriously. Recognize the signs, take precautions, and act fast if you suspect smoke inhalation. Let's make this real. Let's walk through a scenario that highlights the critical importance of wildfire preparedness. Two families, the Millers and the Jacksons, live on the same street in a quiet suburban neighborhood, much like yours perhaps. They are neighbors, friends, and both are now facing the same imminent threat, a rapidly approaching wildfire. The Millers have a plan-go bags, meticulously packed with essentials, ready at a moment's notice. They've thought about what they need and have it prepared. Practiced evacuation routes, ensuring everyone knows where to go and what to do. They've even run drills to make sure the process is smooth and efficient. Masks and first aid kits, readily accessible to protect themselves from smoke and minor injuries. They leave immediately and stay safe because they were prepared and acted swiftly. The Jacksons, on the other hand, delay, scramble for belongings, trying to gather precious items at the last minute and get caught in thick smoke as the fire closes in. Mr. Jackson inhales smoke running back inside, desperately trying to retrieve a family photo album. His daughter burns her hand on hot asphalt while trying to load their pet into the car. In the car, Mr. Jackson coughs and feels dizzy. Classic carbon monoxide exposure, a silent and deadly threat in wildfire situations. His daughter's burn blisters painfully, a constant reminder of their unpreparedness. Their lack of preparation led to real injuries and potentially long-term health consequences. The Millers' preparation minimized risk. They are safe, healthy, and able to begin the recovery process. The Jacksons' delay caused harm, and they now face a long road to recovery, both physically and emotionally. Your actions in the first minutes of an evacuation can determine your health outcome and the safety of your loved ones. Injuries like burns and smoke inhalation are common in chaotic escapes when panic replaces planning. These are preventable with preparation. Don't wait until it's too late. Be the Millers, not the Jacksons. Prepare now, so you can protect yourself and your family when it matters most. Someone's burned. What now? First, stop the burning. Get away from heat, put out flames, remove smoldering material. For minor burns, cool with running tap water for 10-20 minutes. Never use ice. Cover with a sterile, non-stick dressing or clean plastic wrap. For severe burns, don't cool large areas. Risk of hypothermia. Cover with a clean, dry sheet and call 911. Don't apply ointments or creams. Don't remove stuck clothing. Cut around it. Remove jewelry before swelling starts. Priorities: stop burning, cover wound, call for help. Protect the victim until professionals arrive. Quick action can save lives. Suspect smoke inhalation? Get the person to fresh air immediately. Move them away from smoke. Every breath counts. Assess. Are they conscious and breathing? If not, start CPR and call 911. If conscious but struggling, help them sit up and loosen tight clothing. Keep them calm. Panic makes things worse. Don't give food or drink. The only real treatment is high-flow oxygen from paramedics. Red flags, trouble breathing, hoarse voice, confusion, loss of consciousness, soot in mouth or nose. Call 911 right away. Even if they seem better, get them checked by a doctor. Don't gamble with smoke inhalation. We've covered burns, smoke inhalation, and first aid. The key preparation and decisive action save lives. Have a practiced evacuation plan and a go bag with first aid supplies and masks. Leave immediately when told. Don't wait. Injuries happen in chaos. Preparation buys you time and safety. Know how to treat burns, recognize smoke inhalation, and when to call for help. Don't rely on Google in a crisis. Know the signs now. Wildfires are powerful, but you can be ready. Protect yourself and your loved ones by staying informed and prepared. Be ready. Your health depends on it.